Loud, sudden tinnitus in the ears. Why, how, and what to do? This is actually typical and what we consider the most common type of tinnitus. Every day, many people, often in the morning, become aware of this annoying noise coming from their heads or ears. Not all of them will experience chronic tinnitus going to severe or even catastrophic levels. And most of those people will forget about tinnitus within weeks, thanks to the natural habituation ability of the human brain. But to learn more about what is causing this difference in tinnitus conditions, please watch this video and subscribe to our channel to learn more about tinnitus and related issues. Okay, so let's dive right into it. Tinnitus comes in various forms, and if you talk to any clinician who deals with tinnitus sufferers regularly, they will tell you the same thing. Indeed, there are some lucky people who experience the ringing in the ears improving within just a few hours, whether they have chronic or temporary tinnitus. For them, the answer is quite straightforward. However, for many others, it is a different story. They find that their tinnitus sounds remain constant or get louder and more annoying over time. This reflects the impact of elevated sound levels on the auditory system, whether due to loud music or excessive noise exposure. What happens next depends on many factors and preconditions, whether they are in place or not. As you would expect, certain rules and recommendations should be followed to achieve positive changes in tinnitus annoyance and reduce tinnitus noise. However, not many people know what needs to be done and what's important to positively impact tinnitus. Let's be clear about this. The difference between chronic and temporary tinnitus is huge when discussing the sufferer's experience and annoyance levels. Often, even a temporary tinnitus episode from years ago can lead to chronic tinnitus when other factors come into play. Chronic tinnitus usually has multiple factors contributing to its onset. Gradual tinnitus onset is often associated with chronic tinnitus, but sudden onset can also result in a chronic condition later on. The initial strength of tinnitus noise and symptoms, whether it's slight or catastrophic based on the tinnitus handicap inventory scale, plays a crucial role in the success of natural habituation. Natural habituation becomes much more effective when we closely follow the strict guidance and instructions you will hear shortly. Our message to you is clear. Regardless of the reason behind your tinnitus, we must do our best to make a difference in how it develops in the future. And with the onset of tinnitus, we should make an effort to support our brain as much as possible to improve the chances of reducing tinnitus symptoms, and eventually habituating to the tinnitus by starting this process right away and treating this as an important part of our daily activities. Now you might wonder what to do and how to do it. Well, listen and watch this part of our video for valuable insights. And before you do that, don't forget to subscribe to our channel so you won't miss any future videos we have in store for you. Stay informed and take control of your tinnitus journey today. Avoid exposure to loud sounds. Use noise protection ear muffs if you are exposed to loud noise, but ensure you have controlled and limited exposure to noise or stimulation to keep the auditory system functioning. Avoid using maskers or any other devices to mask tinnitus. Infections are sometimes known to cause tinnitus or make it much worse. Protect yourself and care for yourself, especially in the fall and winter. Eliminate nicotine and caffeine and lower the salt intake. Please note that any substance known to have an effect on the patient's blood pressure is going to have a very profound effect on tinnitus. If you know your blood pressure is high, check it often and talk to your doctor. Avoid stressful situations and learn to cope with the stress and anxiety. In the tinnitus treatment process, we teach our patients how to deal with anxiety and stress. Talk to your family physician or check the internet to find help in learning meditations or how to control your stress or anxiety. Because tinnitus affects our anxiety or stress, learning and following basic stress relief and reduction methods, such as listening to guided meditations or using relaxation techniques, are needed and recommended. Get at least 8 hours of uninterrupted sleep every night. Good and proper sleep techniques have a very profound effect on stress or anxiety levels, allowing our brain to proceed with resetting some important functions, improving brain efficiency, and lowering tension, stress, and anxiety. Avoid too much quiet time. There should always be a presence of low loudness sound, quiet radio music, birds, rain sounds, white noise, or any noise you feel comfortable with in your listening environment during the day or at night. If this is possible, do your best to avoid focusing on tinnitus by paying attention to it or frequently discussing it with your family. Please remember that drinking alcohol can boost blood pressure, which can strengthen your tinnitus. Smoking can narrow the blood vessels that bring oxygen to the brain. It can also cause blood pressure to go up and tinnitus to worsen.